Colorado. I'm a little starry-eyed there. I guess that's from my new light. Welcome, everybody. This is our Q&A session. It's Happy Tuesday, Colorado. Gorgeous. Leaves are turning. It's beautiful. The Archuleta life. Okay. Nice to see you. Looks like we're going live on Facebook and YouTube. Samantha Teehee. Hello, Adventurite. Marislav. Nice to see you. Bianca Social. Hello, Lena Cruz. Marila, Drew, Cher. Hi, everybody. This is Dr. Magarelli, CNY Fertility. Today is our wonderful day of Caitlin Puffer. Hello from Wisconsin. Good to see you, my dear, online here. Trina Riggle. Good to see you on the Facebook side. My Instagram side is going phenomenally well. Good evening. Making McLelands. And Judith Glantz. Good to see you. Bailey. Oh my gosh, Twixie 91. I think I saw you last week. Ronnie Diaranjo, greetings to you too. Today we're going to be doing Q&A. So, and I'm going to be finishing up. Hello, everybody. I'm going to be finishing up at about 10 to 5 or 5 to 5. I've got a meeting at 5:15, so I'm going to concentrate it here. I'll be there Friday, Alyssa. Good for your FET. Can I request you? Of course you can. We'll have to arm wrestle Dr. Fink, but I'm sure be happy to do it. But just make sure you give the gals a heads up and give me a heads up. Sometimes I'm on a call with patients, of course. Oh, good. I'm Emily from Colorado. We love Colorado. Elaine Gonzalez is going to see me on Monday. Thank you. Ma Mambasi. Hello there. Jeter and Jules. Cavaliers. Nice. Lindsay Yard. Nice to see you. Nice yellow hat, whatever that is. Road to Buy. Hello. High Maintenance 12. That must be a little bit of work. Can you do IVF if you're using donor eggs, but you have 2 ovarian cysts, or do you have to wait until the cysts are gone? IVF, you're talking about an embryo transfer if you're using donor eggs. As long as those cysts are not over 3 centimeters, and as long as those cysts aren't producing estrogen and progesterone, likely you can, but you want to make sure they're not hormonally active. Let's see. Nina Mendoza wants a baby boy. Okay. And she wants us to have an office in Las Vegas. Not really, we don't, but to be honest with you, that's a direct flight from Las Vegas to Colorado Springs, and we have got lots and lots of space for folks. So all you folks out there who want to be seen soon, just hop on over to Colorado. We'll be happy to see you. Can you use IVF Smart for medication? I'm not exactly sure what IVF Smart is, so maybe you can explain that a little bit. It must be an insurance company. How much extra dose does it cost to pick up the gender? What is the extra cost? It's about $3,000 for IVF with PGTA. Now, pre-implantation genetic testing will also tell you first and foremost whether they're normal or not, then if they're boys or girls. Hello, Crystal from Kansas. All right, so Tonya had a hysteroscopy and DNC last month. Went for a baseline yesterday, and the lining is still 8.4. Can I continue for an FET? No. You want to get your lining around 4 or 5 millimeters. See if a couple of more days, or if they need to give you a progesterone shot to slough the lining, do that. Oh, it's an international pharmacy. Well, Neely, if you do international medications, that's on you. We, of course, in the Americas can't, through the FDA, we can't recommend going outside the country, but as I understand it, all the medications are made outside the country. Do you recommend salpingectomy before or after egg retrieval for bilateral hydrosalpinx? Well, bilateral hydrosalpinx just means there's fluid in the tube, and that fluid in the tube can interfere with implantation. So you can either clip the tubes, easy peasy, or you can remove them. I recommend clipping the tube because it will affect, by doing salpingectomy, removing the tube, the blood flow to the ovaries. And if it does that, then of course that's going to reduce the egg reserve. Which wash is better, a Neupogen wash or an HCG wash? I don't have any data on the Neupogen wash, but on the HCG wash, there is data showing increased efficacy in terms of pregnancy. Carrie Lynn, nice to see you. Jessica, hello. Didn't Governor Polis just sign a bill for outsourcing meds from overseas? I have no idea. That would be great, Jessica. Send me the information. Can I start baselines for FET transfer without a period? Yes, as long as your lining is thin. Is it possible to have a little girl after IVF having 4 boys naturally? Well, yes, you can do pre-implantation with genetic diagnosis for a boy. Do I still need to get an HSD if I don't have twos? Would an SHG be enough? Yes, it would. Or I would prefer, folks, please ask for diagnostic hysteroscopies. Please ask for diagnostic hysteroscopy. They're the gold standards for determining if the inside of the uterus is perfect. So I know HSSs can work. I know HSGs can work. But honestly, a diagnostic hysteroscopy, it's a pap smear with a telescope. We do it in the office. It takes less time almost than an HSG. And honestly, it'll give you way more information about your uterine lining. So please ask for it. Hey, Oksana Moss. Hello. Nice to see you. Keith Scott, do you have to have a trilamina uterine lining for transfers? Yes, because that tells us it's the right lining that's consistent with nature. My E2 is 1600 and my transfer is next Monday. Will it get too high? Not likely, because you're just on, if it's a frozen embryo transfer, you control that with estrogen and progesterone and just ask the docs to back off on some of the meds. Hysteroscopy and transfer in the same cycle. What's your opinion? Never do it. Never do it. Hey, Crystal Bird, thank you for these Q&As. My pleasure. I have fun. Linda Quay Chulpa. Hysteroscopy. Oh, no, I already said that. Definitely do not do a hysteroscopy in the same cycle as you do a retrieval if you're going to do a transfer. The whole idea is not to molest the uterine lining. At least my opinion. Don't molest the uterine lining. I mean, you want that uterine lining to be as beautiful and as in its natural state. You start poking around with a telescope. I'm not sure that's the best thing for implantation. If my husband works overseas, how will IVF work? How will sex work? The bottom line is he has to come here to give us a sperm sample, and that's how it'll work. Basically, we get the eggs from you, get the frozen sperm from your husband. Now, if he can, hey, Joshaman, that's Dr. Banerjee. The great Dr. Banerjee is listening in on today. Love to see you, my friend. But yeah, you can, sometimes some countries you can get frozen sperm over there and then send it. Not likely New York, but Colorado we likely will accept it. I can't say for sure. Is there any clause to the refund if the 6 cycles don't? I don't even know anything about that. Please, if it's financial, don't ask me. Is hysteroscopy during retrieval okay, or do it in separate cycles? I just answered that. Absolutely do it in separate cycles. Is it possible to find sperm through TISA after 2 years of a vasectomy? It's probably greater than 95% chance of finding sperm after that. Sarah, Dr. Banerjee says, or Dr. Banerjee, Sarah says hi. Lydia, does male factor cause problems with implantation in untested embryos? Absolutely. The male is 50% of the deal, folks. So alcohol, tobacco, street drugs, especially smoking, marijuana, poor nutrition, not enough zinc, not enough folic acid, poor health habits, all of that is going to impact implantation rates and miscarriage rates. Can you speak to high FSH and fertility success? It goes down. After 2 IUIs, my levels keep going up, of course, because you're getting older. Could it be the meds? Nope. So FSH is a marker of ovarian reserve. If you're less than 35, you'll lose 1,000 eggs a month. If you're over 35, you lose 10,000 eggs a month. So every month you're in care, you're losing eggs. I have my first appointment at CNY at the end of December. What exam should I get prior to my appointment? Go to the Family Building Guide at the CNY fertility website under Resources, Family Building Guide. There is a list. People out there who your doctor is willing to do, please get your docs to do all that testing. We'd love you to get all that testing done. Why did I have so many immature eggs during retrieval? That's a very hard answer because I don't know your cycle. It could be you only make immatures and you don't make matures. It could be that it was triggered early. You might want to trigger later. It could be that the estrogen was too high. Lots of reasons. Hey, Dr. Mag, I have an intralipid uterine wash on the November 1st and transfer on November 2nd at your office with Dr. Fink. So excited. Yay, Michaela. Well, that's great. I'm glad. What are you supposed to have for an FSH level if you're over 35? Less than 7. The family of Jessica, my dear Jessica, is helping us again, as she always does. If you're on the Facebook, she has put out where to get the family building guide. Lupron or Alyssa for endometriosis prior to another FET. Well, surgery first, and then possibly Oralissa, I think is easier. My first FET failed. PGT normal 3AA, intralipids acupuncture, good for you. Hysteroscopy, ACG wash, did it all. Any suggestions? Second transfer next week. An ERA, an endometrial SARA endometrial receptivity assay. Hey, Doc, I'm 44 and I have one frozen embryo waiting for transfer in January after doing ERA this December. Good. What's your advice on the protocol to use to improve my chances? Renee, definitely start your acupuncture now. You go to the American Board of Oriental Reproductive Medicine, look for your state, and then find a board certified and start working with herbs and with acupuncture. Serovital, something you can get over the counter from Costco. See if they can prime you for a couple of months with HGH, human growth hormone. Do an HGH, maybe do a PRP wash. What does estrogen do? Is 149 good? I don't know why we're measuring estrogen, my dear. If you're pregnant, you should measure pregnancy hormone. Caitlin just got 3 full cycles paid by insurance. Oh my God, that's fantastic. Would you suggest doing another retrieval, throwing out my 3 day 5s to push to day 5? Do another retrieval. Do another retrieval. Embryos in the freezer is everything you want. Samantha, I'm like, is he not seeing any comments left? You did so, I guess he is. What? I didn't follow that. I sometimes, folks, you don't have, you can see that I have 3 screens I'm dealing with here. Can eggs mature in the lab? Yes, we actually grow them overnight to see if they will. Our consults is for February. How can we get a sooner appointment? You get on a waiting list. I'm sure it's going fast for him, so keep asking. Yes, please ask questions. My first FET failed. I'd like to do a lap this cycle and ERAs next cycle. Perfect. Is it best to transfer the following cycle or to wait 2 or 3 cycles later? Well, after your laparoscopy, you should be able to transfer within 6 to 8 weeks. Lindsay, how many times per month for acupuncture before an FET transfer? It's really how many total treatments. If just in our studies, which Dr. Credenda, Eastwind's acupuncture guys, go to Eastwind. If any of you are coming to any of our care here in Colorado, contact Eastwind's acupuncture before so you can set up your acupuncture. They have 2 great docs, Dr. Credenda, Dr. King. Of course, Dr. Credenda is my wife, as full disclosure, but she and I are the ones who created the Credenda Magarelli acupuncture protocol. So if you're coming to Colorado, even if it's for just 3 or 4 days, see if you can get in and get a treatment from the author of the study and her protege, Dr. King. Why not measure estrogen during pregnancy? Can't low estrogen during pregnancy contribute to miscarriage? Not as far as I know. How many failed transfers until you recommend a laparoscopy? 2. So if you are pregnant, does estradiol not be needed to monitor along with HCG? Well, some people monitor it. I'm not familiar with it. I don't know what you can do about it. In my mind, it's progesterone, progestation that's critical. Do you have a BMI limit? We do not. Dr. Kills suggested priming for 30 days and also laparoscopy. Should I do the laparoscopy first, then priming, or prime while I wait for laparoscopy? Prime first. Ladies, feel free. Vanessa is up to join the CNY fertility group. Yahoo! Please do that. Kirsten Lakinski. I'm 40. Do another retrieval for siblings for my 22-month-old twins. Last cycle ended with 8 PGDS and only my twins. Scared of more losses. I don't know if there's a question in there. Is there an upper limit for estrogen for baseline labs before starting stims for an egg retrieval? No. Well, you don't want it too high because it means you have an active cyst. Is FVT more successful with or without Trigger and Letrozole? Gosh. I don't know. With or without Trigger and Letrozole? Oh, I think the Trigger is more precise. So I don't know if it's more successful or more precise. I know. Okay. Woof. How can one regulate their cycles without birth control? I have PCOS. Well, one of the #1 ways to regulating is weight loss. I don't know if that's an issue for you, but that's if you can lose 10 to 15%, which is not a lot, of weight, if you're overweight, then you can actually get your periods back. So that's one way. And also acupuncture. Acupuncture. I've had 2 failed IVFs. Do chances go down with the third? No. You should learn from each one. Thoughts on steroids and Lovenox for recurrent implantation failure? And yes, please do the steroids, do the Lovenox. Well, mostly the Lovenox and baby aspirin. Those are the key. Eastwindsacupuncture.com. Thank you, Jessica. That's the link for you folks. Rosin, I'm 42. I've primed with estrogen and progesterone for 14 days. I stopped it 7 days ago. Estrogen today is 117. Progesterone is 334. No bleeding yet. What shall I do? Start stim meds? Well, just wait a couple of more days and have them repeat the test, and you should be fine. I have an appointment with CNY in January. I have seen 2 other fertility specialists. One was worried about my positive anti-nuclear antibodies, and the other was not. Should you be concerned? Well, if you've had recurrent pregnancy loss, then yes, be concerned. If you haven't, we have an immune protocol. Most of our immune protocols take care of that issue. Dr. Mag, Maria, my FET was on 1020 and my midway labs were yesterday. P4 is 41. Wow, B2, that's a good sign. Sarah, hysteroscopy during my retrieval at 9.6, transferred 10.5. Wasn't successful. Do you think I transferred too soon? No. Is the TSH is too low? Can it hinder the success of IVF? TSH too low? No. What's considered, guys, wow. Do you recommend fresh or frozen transfers? Yes. It depends on the person. It depends on your circumstances. There is no one better than the other, but for some people, one is better than the other. There's no basket. This is good. This is bad. Hysteroscopy to remove polyp and ERA on the same cycle? Absolutely. That's not a problem. Alyssa, if I do an ERA cycle next cycle and then end up doing another egg retrieval, will I have to do it? No. Once you do an endometrial receptivity assay, that's good for about you don't actually have to change it. In other words, you don't have to do it again. At least that's the data so far. How long should we wait to try again after a chemical miscarriage? The next month is fine. Does CoQ10 help egg quality? How much to take? Go to the Family Building Guide, and we have all that information there. It starts with The Egg is a great book to read, and there's a lot of data there. And what is considered a good level for the first beta? Anything that's positive, Maritza, in that lab. Can I do an ERA during a lap surgery? Only at probably CNY Syracuse, I'm guessing, because I don't know how they would do that at a hospital. I don't know how that. Should I continue birth control pills until my appointment, or would there be a reason to stop taking it? Well, it depends on why you're taking birth control pills if you're trying to get pregnant. Hard to give you an answer there. What supplements are recommended for an FET in an early pregnancy? They're all the ones that are in the Family Building Guide. Ladies, feel free to join and gentlemen, if you feel like it, feel free to join the CNY fertility group. Camilla, my AMH is 0.5. FSH is good. Will it be good candidate for IVF, or would I be wasting my time? No, Camila, you're not wasting your time if you want to try to have a baby with your own eggs. We will help you. Okay, C. Guya, go straight to, okay, C. Guya, I guess that's a person. Go straight to IVF. This is what Vanessa is saying. So, Tonya, if my lining is not thin enough on cycle day 5, when would I ask for progesterone shot? Now. And when could we try a FET after you have your period? Lindsay, when should you stop birth control pills before a frozen transfer? I take them to keep a cyst off my ovaries. Well, you could stop the birth control pills at the start of your medications for your frozen embryo transfer. Judy Gallant, yeah, I've known G's had that software for follicles forever, but that doesn't mean anything. It's just measuring circles. It doesn't mean they're active. It doesn't mean anything. Mine as well. What? Will antidepressants that my husband is on affect sperm quality? Not that I know of, but Lexapro will affect ejaculations. What is a good priming program for diminished ovarian reserve? Well, this is Heather. I would do estrogen, with cyclic progesterone plus continuous growth hormone, a minimum of 6 units. 18 days at the minimum. Had an ultrasound for baseline lining is over 7, but still had 1 good day of bleeding. Okay to start meds for FET. Probably, I might want to come back and do another scan to see if it's less than 7. Is Menopure better than Gonalef? No. Emily, you're welcome. How many appointments are generally needed for an IVF cycle? Well, an IVF cycle, this is reishi babies. An IVF cycle is 11 days of medication on average, and those medications are injections, and you'll have 4 or 5 ultrasounds before you go to get your eggs out. Now, if you live in the same city, then do all your monitoring or close to the city, within an hour of one of our offices in New York or Florida or Colorado or Atlanta or Philadelphia, then go to our clinic to get monitoring because, gosh, that's the most accurate for us. But then you'll expect to go to whatever city to get your egg out, okay? And then expect to be there at least a minimum of 48 hours if you're just doing a freeze-all, or up to 6 or 7 days if you're doing a day blastocyst transfer. Why do both an HCG wash and a PRP for the uterus? I was told it was part of my IVF in December. Not sure why both. Probably because you've had issues with your lining. First, a retrieval regimen option. Gonalef. Wow. Serovital, Erika, and Serovital for everybody. I don't know how you're age 30. You're diabetic. AMH is 10, Gonalef is 200, LH is 20, Ganirellis, Lupron, Trigger. Boy, that sounds perfect. Be very careful of ovarian hyperstimulation. You're very welcome. I had an egg retrieval last Wednesday, but there were no follicles. What could cause no follicles? Well, Franco, one of the things that could have happened is that you could have ovulated. Another is that you didn't. Yeah, that's probably if they were measuring follicles and they disappeared, you could have, some people, what they call breakthrough. Well, when CNY start doing transfers in Florida, probably June 2022. Do you think Neupogen injections are, sorry, I don't know what that is. Started taking metformin for egg quality, but my period was only 2 days long. After starting metformin, should I stop the metformin? Ingrid, don't worry about your period length. If you're having it regularly, that's good. What is the possibility of conceiving using donor eggs and upon entering menopause? Oh gosh, minimum about 40–50%. It could be as high as 80%. Success rates go down after 35. Would I be better chance for transfer if my embryos were from age 34? Yes, of course. Could triggering too early cause a chemical pregnancy? No. For our next egg retrieval, we are doing HBA on the sperm. Don't know what that is. When will Atlanta start doing egg retrievals? We have no idea. I'm 30 and I had 3 miscarriages after testing normal AMH 1.7. Could this have been an egg quality issue? Could have been. Is anyone else seeing my comments, or is my app not working? I'm so confused. Samantha, I think I've answered your questions a few times. When in the cycle is it determined if you are a good candidate for a fresh transfer? Well, you should plan that before. If you guys are planning, you should plan a fresh or frozen transfer. You should do that. Oh, thank you. I love my shirt, Be Noble Jack. This is my favorite shirt. Thank you for telling me. Can you go over TISA, please? Well, that's just simply testicular extraction of sperm. So you go directly to the testicles in men who don't produce sperm on their own, or they do produce sperm and it doesn't come out. You go into the testicles, you take the sperm out, and that's what it is. Now, there's many different ways. You could do it microscopically, you could do it with a needle, you could do it with surgery, but that's how it takes place, and it takes about 10 minutes, and you probably miss a day, maybe 2 days of work. You're sore, but that's good. So what helps? What helps egg quality? Well, no alcohol, no tobacco, no drugs, Serovital, growth hormone, acupuncture, a low-carb diet. That's what helps. I may have missed the answer to my question, but how long would you have to recommend waiting to have IVF after undergoing a LEAP procedure? At least 6 weeks. Are embryo grades a big indicator of whether an FVT will result in pregnancy? Absolutely not. That's a big point, folks. Don't worry about your beautiful embryos, whether that they're grade 1, 2, 3, 4, A, B, C, D, 3AA, 3BB, 3CC. If it's a viable embryo, it can make a baby. Study after study after study has shown that grading itself does not tell you whether you're going to have success or not. Can endometriosis cause a miscarriage? It's associated with it, but not causative. The tech really hurt me trying to place a speculum, and they had to call the OB team. After that, they couldn't get the tube through the cervix for the sonohysterogram and sent me home. What should I do? Heather. Heather, I don't know what state you're in, but if you're close enough, you might want to come to one of our centers. Do you recommend, or they can use misoprostol. The other thing you could do is ask them if they can use misoprostol, misoprostol. Do you recommend Zymot for a smoker with low motility? Do you recommend Zymot for a smoker with low motility? I don't recommend Zymot. I don't not recommend Zymot. I'm still I'm on the fence as to its efficacy in terms of helping you get a baby. Zymot was passed by the FDA as simply a sperm separation, nothing to do with pregnancy, nothing to do with quality, nothing to do with outcomes. It was passed to separate sperm. That's it. Quick and easy lab test. Do you recommend Zymot for smoke? Oh, you asked me that 6 times, Rosin. Don't smoke. That's what I recommend, Rosin. Don't smoke. I had the pleasure of going to the East Winds prior to my Fvt last Tuesday. Lovely facility. Sad I can't frequent them since I live in Colorado. Thank you, B. Noble Jack. My AMH is 49. I know that's very high. Is that good or bad? Well, it's not good or bad. It's just you have to use that information, Gwendolyn May, to determine what's the best and most optimal treatment. That's all these tests are, by the way. Best and most optimal treatments. With an AMH of 0.275, what is the possibility of conceiving and what can be done to my eggs? Well, Winsome, you have to tell me how old you are. And IVF, of course, to get as many eggs as possible. And that's what I would try. Where am I located? Everybody, it's Paul Magarelli, CNY, Colorado. Been here almost a year and a half now. Or I'm sorry, I've been here 30 years. And I partnered with my best friend Robert about a year and a half ago, and it's wonderful. It's wonderful to be able to take care of so many people. Thoughts on testosterone priming? You know, I would measure your testosterone first before I would add any testosterone at all. Can Serovital and HGH be taken together? Absolutely. Is it good to have Serovital to ovulate? Not at all. Evix, thanks for the kisses. Evix, Serovital is a growth hormone secretagogue, so it's going to help sperm, it's going to help eggs, it's going to help the uterus, it's going to help your skin, it's going to help your hair, it's going to help your health. You're 46 years young, and you have a low AMH, which is very typical. So it's a challenge. It doesn't mean you can't do it, but it's a challenge to get eggs and to find eggs that are normal. So you might try one cycle, and I would do a mini IVF cycle and see if you can get eggs. And if you can, see if they fertilize. And if they fertilize, see if they can grow. And if they grow, you're as good a chance as anyone else. Drew Washer, if the ovarian cysts are producing estrogen in greater than 3 centimeters, does that mean a greater chance of miscarriage? No, it means don't do the cycle. What do you recommend most for couples with unexplained recurrent miscarriages? 30-year-old PCOS, all test normal. Acupuncture, number 1. I would say add growth hormone Serovital. Make sure you've done a workup for the unexplained recurrent miscarriage. Certainly Lovenox and aspirin have shown to be helpful. Okay. Oh, now on this side. Does Metformin help with the frozen embryo transfer? I think Metformin helps with helping folks who can't do the low-carb eating. I think low-carb eating is a better way to adjust for insulin resistance, and that's what Metformin is doing, is it's sort of correcting for high-carb eating. How long can I expect the HCG wash to stay in my system? Well, it's not in your system. It's just basically bathing just before you do your transfer, the lining and priming it. So at least I would think, I don't know what the studies say, but I'm betting about 48 hours. I was thinking of having it, everything went well except my glucose is very high. Do you think it was possible to do? Now, remember, high sugars in a diabetic are associated with miscarriages and stillbirths, which are horrible. Okay, miscarriages are horrible too. Do you think adding new vegeta injections is important? I don't know if there's any studies in terms of its help with fertility. Does going to a chiropractor help with fertility issues from PCOS? Not that I would not know a mechanism. I would not know a mechanism. Would HCG show up on a pregnancy test? It could if it's too soon. Guys, please don't get your pregnancy test at 10 days. Get your pregnancy test at 12 to 14 days after the transfer. I know you're desperate to find out the answer, but it's so much better. Is intermittent fasting better than the keto diet? No, they're both very effective. I actually do both. So whatever you can do to be consistent. Prednisone makes my blood pressure go high. Is it necessary for immune protocols? No, not if your blood pressure is going up. Can I get an insemination with diabetes? I'm assuming Ulishermanson. I'm not sure. Desbeta? Don't know what that is. Do you take Serovital during your retrieval medications? Yes, and also prior. Does your clinic in Colorado do septum correction surgery? Yes. Is it normal for a gestational sac to measure behind the crown lump length? Well, Anna, those are all set up by your OBGYN in terms of their normative values. Just watch it grow. Just watch it grow and have faith. They said I had follicles on the left and right. Would this be a positive sign, Heather? Gosh, Heather, I don't know what the original question was. Sorry. Yes, having follicles on both sides is a good sign. Thank you. The keto diet caused increase in my migraines. Yes, do not do it. Do not do it. Do not do it. Do intermittent fasting. Do the Mediterranean diet. But just try to avoid carbs. How long do I need the Serovital? I would say at least 90 days minimum. I mean, keep on it. I take the Serovital absolutely every day because I'm an old man. Can weekly intralipids substitute for not doing metformin? I don't think anyone has done a study. Intralipids are just simply a soy-based fat that they instill in your IV to reduce inflammation. A high-fat diet can do it too. So if you don't want to do intralipids, high-fat, moderate protein, very low-carb diet. The reason to avoid carbs is inflammation and insulin resistance, which causes hyperandrogenism, which in turn interferes with ovulation, which in turn interferes with implantation, which increases miscarriage rates. So there's many reasons to control the sugars in your diet, the carbs in your diet. And by the way, carbs are anything that's not a bird or a cow. Carbs are anything that's not oil. Ice cream, candy, cakes, cookies, fruits, juices, vegetables, especially below the ground vegetables like potatoes and carrots and beets are all sugar. Is there a reason to avoid carbs and inflammation? Absolutely. The very fact that you're saying inflammation, that's associated with many, many bad things. Can my eggs be stimulated? What does you recommend to stimulate my eggs? IVF. Hi, doctor. My AMH is 0.01. Do you think that I will have success with my own eggs? I'm already a patient at CNY getting ready for an IVF in December. Yes. I mean, numbers are just indicators of the likelihood of getting an egg, but we never know if that number correlates to that person. We just know to a population. Is there anything else I should do for my retrieval protocol if I have chronically high CRP, C-reactive protein? Don't know the answer to that. How do you keep eggs the same size during the stimulation? Sometimes you can do that by down-regulating with birth control pills for a couple of months, and that resynchronizes the cohort. That's what we used to do in the old days. Sometimes you just can't synchronize them. Hi, Doc. Oh, I already did that. Erica, medicated transfer versus assisted natural. Medicated transfer. Medicated transfer. I am not a big fan of not helping. So if you do natural or assisted natural, just let us control all the variables so that increases your likelihood of success. That's my opinion. And by the way, if you asked me a couple of times, I'm in Dr. Magarelli from CNY, Colorado. Earlier you said recommending pinching off the tubes instead of removing them. My laparoscopy is next week. The nurse practitioner at Colorado said they can remove hydrosalpinx and leave the tube. No, you can't. You can't remove the hydrosalpinx and leave the tube. I am 41 and first egg retrieval. I have 2 to 3 follicles. Am I considered to have diminished ovarian reserve? Should I do a mini next or a prime? Well, get your... And first, I have 2. Okay, Heather Moss Baker, get your eggs first. Then figure out the next step by talking with the doc. Okay. All righty. Down here, up over here. What happens to eggs during pregnancy if it takes 90 days for them to mature? They don't hibernate. They just get resorbed into protein, fats, and carbs, and the body uses them. Rosin, do you recommend the 3rd myomectomy? Largest is 4 centimeters before transfer, or take the risk and transfer without the myomectomy? My concern is where the fibroid is. If it's submucosal, it means inside the uterine cavity, don't do a transfer. What could be the cause of a low AMH at 24? Sumaya. It could be genetic from your mom. It could be a result of toxic exposure. It could be Hashimoto's thyroiditis. So get your thyroid panel, including the anti-thyroid antibodies. That's the top 4. My consult is in February. We plan to be seen in Colorado Clinic. We are so excited. Well, thank you, Gwendolyn May. Hi, doctor. You doing our transfer today? Thank you so much. You're welcome, Stephanie. You should be relaxing. I hope you're relaxing. Does low back arthritis affect IVF? Well, arthropathies, especially rheumatoid type, can be an inflammatory process. Our immune protocols, make sure you bring that to our attention that you have documented arthritis and what kind. Does Colorado still do retrievals in December? Yes, we do. My left tube is blocked. Does that affect the success rate of IVF, Nicole? No. My left tube is blocked too. Getting a TAC done pre-pregnancy due to IC. How soon after can we do FET? What the hell? I don't know what all of that means. All those initials, Jeanette. Sorry. Should I do an endometrial egg retrieval shortly after a miscarriage at 10 weeks? Well, again, get your embryos. Make embryos. Put them in the freezer. Then figure out a time to do the transfer when it's best for you. Does back pain affect IVF? Not really. But if the block is hydrosalpinx, doesn't it affect IVF success? No. There's a difference between a block tube, which means no dye goes in there, and an open tube, and the dye gets stuck in there. That's a hydrosalpinx. Very different. You can't have your tube cleaned out. Hello. Purple Irvid and Renaji Jiva. Nicole, should I try to... Oh, we already did that one. Okay. Okay. Well, they just had another study come out that the COVID vaccine is not associated with miscarriages. So again, folks, if you're not haven't had your vaccine yet, please. It is good for breastfeeding women. It's good for pregnant women. It's good for infertility women and men. So if you haven't had your COVID vaccine, please get that done. We don't like you to do it during the transfer, but we sure in heck like you to do it before the transfer. So if you can do it, please do it. What diet should I do to help it make more successful? Sarah is a low-carb, moderate protein, high-fat. Keep your carbs below 50. That's not ketosis. It's not a keto diet, but you can really do it and have fun. What happens to the dye that is stuck in the tube? It gets absorbed. What priming protocols have you seen the most success with in women over 40? Growth hormone. Why would I be put on immune protocol too if I get pregnant easily? I'm just curious. I haven't been diagnosed with any lining problems or implantation problems, Nicole. Well, that's our base. We do that as like baby aspirin. We do that for everybody. Oh, the journey through IVF. Hello, my dear. Good to see you. Can I get a flu shot 4 weeks prior to starting my IVF cycle? Yes, you can get the flu shot and the COVID vaccine. Let's see. Any other interesting things we can talk about? As I mentioned before, please, hi, kissy kiss, everybody. Hello. Make sure you guys ask for a hysteroscopy. Try not to do a hysteroscopy the same cycle you're going to do an embryo transfer. I really wouldn't recommend it. If you had 2 failed frozen embryo transfers, you might want to consider a diagnostic laparoscopy to see if you have endometriosis. How long after laparoscopy can I go in my next IVF cycles? About 4 to 6 weeks, probably closer to 6 weeks. You'll have a better, well, laparoscopy, especially if they did surgery on your ovary, you might wait for 6 weeks. 6 weeks. Oh, nobody's talking or asking questions on my Facebook or YouTube side. I wonder why that is. Huh. Anybody on the YouTube side or Facebook side there can say hello just to make sure that's running still? There we go. All right. I have a single copy of the MTHFR. I take iron daily and methylfolate. Great. My pre-consult blood work came back and I have low ferritin, vitamin D, and B12. Holy moly. Everybody's there. Hi. Okay, stop saying hi. Because now I can't read the questions. Let me go run up here for a second. This looks like an interesting one. What else can I take that I should instead to help raise my levels before my consult? Well, a balanced B complex, if you have and especially the folate as methyl tetrahydrofolate. Don't take methylfolate. Good. That's good. Today was my first beta. It's 6:24. Do you think it indicates twins? Amira, you'll know in next week or so whether you have 1 or 2 sacs. Everybody, wish her luck. All righty. Any studies with success rates during HCG wash and PRP for uterus? Nope. Healthy 35-year-old only missing tubes. Is it safe to put 2 high-quality embryos? And depending on genetics, do not. Always put 1 embryo at a time. What should we look for in our genetic testing to decide? You can't. The genetics that we test for the embryo are chromosomes. The genetics that they test for your carrier screening are genes. They're not the same. How long do I wait between egg retrieval and an open myomectomy? And we could do the following month. Thank you so much for answering all the questions. I look forward to meeting everyone at the Colorado Clinic. Thank you. Any suggestions for thickening my lining? Well, acupuncture and herbs. Viagra you might try. Get your estrogen by injection. Vaginal estrogen. There's not a lot of tricks in our bag. Maybe growth hormone. Oh, PRP washes. PRP washes. Hi, Dr. Mag. Today was my first. Oh, we already said that. Okay, congratulations. Hi, 40-year-old, first frozen transfer, miscarried at 8 weeks. Sorry. Tested embryo and all blood work was normal. Any recommendations? Yes, an endometrial receptivity assay. Please do that. Is AMH13 a chance to get pregnant? Very good chance. Eating healthy and exercising and eliminating sugar. Any of the tips to cleanse the body of glucose? This is Eula Shermanson. You're not cleansing the body of glucose. You're basically substituting good fats and protein and low carbs. Anything I can do to keep my uterus healthy and from shrinking in early menopause, waiting a donor egg? Yes, beyond hormone replacement therapy. Absolutely. Do you recommend egg retrieval before endometriosis? Yes. Any thoughts on why my embryo quality would go from great, my first retrieval, to very poor, my second, amber? Well, there's an age issue. There's a cohort issue. There's a time issue. Do we do acupuncture before egg retrieval or before transfer? Yes, before both. The Credenda Magarelli acupuncture protocol is both. And so if you have questions about that, go to the American Board of Oriental Reproductive Medicine.org, ABORM.org, and they can find somebody close to you who knows our protocol. Is iron very important for pregnancy? Well, anemia is counter pregnancy, so don't be anemic. Miss Puffer, had lap and hysteroscopy last week. They found nothing. Can I do ERA next cycle? Absolutely. What can I do to prepare my body for a frozen embryo transfer? Read the family building guide. What can the laparoscopy tell me about the next steps in terms of the IVF process, whether you have endometriosis? I was told I have a hemorrhagic cyst on one ovary. There's blood flow identified as likely to hurt the process. I had a miscarriage from IVF last year. That's a pretty big cyst. It may get you fewer eggs, but you have to weigh that with your age, etc. Hello. Whee! All righty. I heard wheatgrass lowers FSH. Nope. I have tried Viagra injections and waited 4 cycles and my uterus only thickened to 7.3. Megan, anything above 7 is fine. And it was a failed implantation. I did the PRP twice and HCG wash, plus I did acupuncture. No, it's just it might be an egg issue, but anything above 7, you should be fine. Thoughts on day 7 blasts? If they are viable and they're growing, put them in, they make a baby. Are they as likely to end as live birth as day 5? No, but who cares? If that's what you have, that's what you have. What are the success rates of IUI after endometriosis diagnosis? Well, it depends on the age of the female, her AMH, and her previous history. If I pinch off my tubes with the hydrosalpinx, can I do retrieval after or can I do retrieval before I pinch them off? Do your retrievals always before major surgeries because there's always a risk something happens. So you want to get the embryos in the freezer before you do surgery. I'm 24, my AMH is 0.9. You could do a regular IVF protocol, but add growth hormone. My ANA is positive despite thyroid treatments. Will that negatively affect my egg retrieval? Not the egg retrieval, but it may affect the implantation and ongoing pregnancy. My husband has an abnormal semen analysis. Depending on how severe the semen analysis is, that'll determine how easy it is for you to get pregnant naturally. But if you're going to get a semen analysis, it means it's not working. How long does it take to get a reply back on a consult request? Someone said 3 months, but I don't know that. Someone can help her. How long does it take to get a reply back on a consult request? I have endometriosis. What can cause that? Well, basically, it's an infection or inflammation of the uterine lining. Many different things. You could have had the flu. It could be an infection from the vagina. It could be many. It could be diverticulitis, many different things, but you should treat it. Is immune protocol a pretty common IVF approach for our practice? That's considered the base approach for someone who doesn't have any major issues. If you have major issues, you might do immune protocol 3 or 4. Initial consult is 3 months. Follow-up is 2 to 3 weeks. So Amber gave an answer to that young lady. So it takes about 3 months. Thank you, Amber. Very appreciative of you. There you go. Is it normal to get ovulation like discharge 10 days before transfer? Yes. Because of the changes in the protocol from estrogen to progesterone. I think I'm answering your question. When is silent endo considered? After failed transfer? Usually, yes, after failed transfer. Definitely, folks, get on our cancellation list. We're adding patients every day from the cancellation list, so don't be discouraged. If you have polyps in your uterus lining, do you have to get it removed prior to embryo transfer? Absolutely, Cito. It says, Oksana says it's much quicker if you call to make your first appointment. Oh, I'm getting kisses. That's hugs and kisses from the journey through IVF. Thank you. At 35, AMH is 1. First IVF cycle canceled on stim day 10. Only 3 follicles ranging from 9 to 12. So you didn't respond. My estrogen went from 117 to 71. So your medicine wasn't getting inside you. So you might want to ask them, no, you're not oversuppressed. You might want to ask them to do your shots in your deltoid muscle. All you folks who have worries about not responding, you might ask to get intramuscular shots because the distribution of the medication is better. After 3 retrievals, 2 chemicals, and 1 poor embryo quality, at what point would you suggest looking at donor eggs? For you, Amber, I would say that it's always good to look. I do. The goal is 1 healthy baby, and I've thousands of donor egg babies that you can't tell one from the other from a naturally conceived baby. So their love is love. Love is love. Do your chances of success decrease each transfer? No, it's not a function of the transfer. It's a function of the quality, but it's also a function of the age of the eggs. Carrie, to rule out endometriosis, does one need a hysteroscopy? No, a laparoscopy. Laparoscopy. Can you talk about adenomyosis? I had 3 failed FVTs. Is this why? Purple REVD. Please, I did a whole talk on adenomyosis. It's on the whole hour I spent on it. So go look up on our CNY fertility website for the old Facebook Lives stored there, and you should be able to find it on adenomyosis. Do you recommend transfer of 1 or 2 embryos at 40? If they're untested, Naomi, you could do 2 reasonably, but if they're tested, 1. Do you prefer Gonal-F plus Metformin or low-dose HCG? Actually, either way. Is there any way, Amber, to know if the poor embryo quality would be a sperm or egg issue? And as always, thank you. Of course, Em. I'm appreciative of you asking me questions. Typically, it depends on the age of the female. The egg quality kind of trumps everything, especially if you're getting fertilization. If you're not getting fertilization, then I kind of worry about the sperm. When you say major issues with conceiving, could that be ruled out in the beginning with a blood workup and initial consult? Amanda, I don't remember your information. If you're talking about age and AMH, older age and low AMH, I think that's what I mean by major. In other words, it's going to take longer. The other thing to remember, folks, IVF is a 40% success in the United States if you're under age 35, under age 30, really. That's it. That's it. And that's after, so that means folks under 35 will take 3 IVF cycles to make a baby. So that's our biology, and that's our technology as it stands now. I know everybody on the websites all over the country put 90, 80, 70, all these crazy numbers, but all you have to know is that it's about, and that's been corroborated by all kinds of data over the past 20 years. So don't get disappointed if it doesn't work on the first time. Is it possible one gender has a better success of implanting? Anything's possible, Sarah. I had 2 miscarriages after a heartbeat due to chromosome issues, but it's supposed to be rare. Then do IVF with pre-implantation genetic testing, PGTA. That's what I would recommend. What is the time between initial consult and first appointment? Well, about the initial consult, first appointment, probably 6 to 8 weeks. Brandy, can I stop intralipids? I'm 6 weeks. You might ask the nurse what the protocol is, but congratulations, Brandy. Are these talks saved on the website to watch later? All of them, Danielle Leitner, all of them. We save all of them. I save all of mine. Sometimes there's a mistake, but yes, we save them for sure. We do. So I have about 3 more minutes of questions that I can answer. I have to, as I mentioned in the beginning, got to get going to another meeting, actually, at about 5:15, and it takes me 20 minutes to get there. So you're very welcome. About 2 months, just had my consult on 10/25, and he said December we can do IVF. There you go, Nicole. There's your answer. So next week, I'm not sure what I'm going to talk about. I think I'll try to finish the last chapter of my endometriosis talk, and that's a talk about the impact of endometriosis on IVF outcomes. So next week, it's going to be focused, so tell all your friends, on endometriosis and its impact on IVF outcomes and what you can do about it. You're very welcome, Brandy. the goal there is a half an hour of discussion. Usually it's going to, and by the way, it's all done on Facebook and YouTube. Instagram doesn't let me put up slides. So on Facebook and YouTube next week, we'll be talking the last of the 3 chapters of endometriosis that I was talking to folks about over the past month and a half. And my goal is to keep building a library for all of you, so that you can go and refresh yourselves on different topics. And if it's a topic, you'll see that topic is listed, and I try to put it in the name of the talk. But the key thing to remember, folks, is nature wants you pregnant. You're not fighting nature to get pregnant. It seems like it, but you're not. And we just have to figure out how to help. And our goal is always to help. Find ways to get you there quicker, easier, and less expensively than just about anywhere in the country or the world, for that matter. So anyway, folks, thank you for sharing your day with me. I truly appreciate it. And I plan to keep going with these. And I am hopeful that these help, and they'll bring you some understanding, and then use them, by the way, when you're talking to your docs, and say, hey, I heard this by Dr. Magarelli, board-certified reproductive endocrinologist, specialist in integrative reproductive medicine, acupuncture, IVF. I want to, again, I always forget this, but I don't always forget it. I always remember this, but the thank you to my team, embryologists, front desk, the nurses, the MAs, the clinical, the procedures, the admin, the financial. Thanks to Dr. Kiltz, of course, for creating such an amazing platform. And thank you all. This doesn't work without you all. So you guys have a wonderful day. I'm going to sign off. This is Dr. Magarelli, CNY, Colorado. Good night, everybody. Bye-bye.